Hello, this is Nilayan Villarin, and as part of our Sports Science 130 class, I will be demonstrating to you the first aid on choking. So basically, choking itself is caused by a material that is causing blockage on the airway of the patient, be it a food or commonly other materials such as the dentures. So on most instances, choking is caused by eating too fast or not chewing the food you are eating enough, or also, as mentioned, when your dentures is loosely fitted to you. And also, choking is common to those that has been taking alcohol, because alcohol causes disruption into your mind and it lessens your consciousness and awareness. Also, it is common to those that are stroke patients, since they have lesser control on the muscles in their body. Also, to those that has brain damage. Choking can also be affecting those that has neck tumor, those that has damage on the esophagus, and also those that has enlarged tonsils. They are vulnerable to choking. So choking can be very dangerous because it could cause suffocation to a patient if we are unable to respond instantaneously. So now we will have a demonstration, and by this case we have a patient that is at age of 18 to 21, and he has been choking just recent, and we will try to respond as fast as we can. Let's do it fast. So here's the patient that is having trouble breathing. First hand, that we will, as we administer first aid, we will ask him, "Nang sa kanatukan ka? Makaya ni mag-ubo?" Okay. So the first thing that I have done is I've asked the patient to verify if indeed he is choking or he's just somewhat having trouble or whatnot. And also, I tried to ask him to cough. Kaya na mo iubo, kaya para ikaw na lang makaya ni mo. Sige daw, hinahinayang daw, tayo na legit ka kaya? I am trying to ask the patient to cough by himself so that he can do mitigation by his own. Because if he can, then there is no longer for us to help him. So since he cannot cough, that means that the thing that is blocking his airway is somewhat big, that he cannot do it. Now, we will be proceeding on administering health to our patient by slapping the back of the patient. So procedure here, we should first support the front of the patient, lower the head of the patient, and we will be giving 5 slaps at the back to induce force to for the patient to get the thing or matanggal on his own. I mean, something siyang baba. So we will be tapping 5 times. 1, 2, 3, 4, and 5. Dito? Open daw. Napaghapon. Kaya ba ni magtanggal? Di naman makaya tanggal. So now, since we are able to try the first support that we can do, we will immediately proceed on trying to induce Heimlich maneuver, which will cause a greater pressure and more chance of removing the material from his throat. So here, I will be having my hand fisted. Relax lang ha, tabangan ta ka. And try to push from his navel to his stomach. Give 5 pushes and try if he will be able to remove the material from his mouth. Inuhan ta ka ha? Relax lang ha? Iluwa kung makaya nimo, kung makaubo ka, ubo. Sige daw. 1, 2, 3, 4, and 5. That is the Heimlich maneuver. And similarly, the patient was able to remove the material from his mouth. However, due to his very instantaneous amount of energy exerted to remove the thing from his mouth, the patient is now losing the energy and somewhat trying to, lost consciousness. Herein, this scenario can be possible since when you try to exert energy, it could exhaust you in the longer run. So now the patient, nakuyapan siya, and now we will proceed on giving first aid to a patient that has fainted. So basically, faint itself can be caused by pain, exhaustion, hunger, emotional stress, or by heat. We've learned that on the heat exhaustion to which fainting can be possible. So by this scenario, it has been few moments that the patient was trying to gasp his breath since his airway has been blocked. We can assess that the patient has lost, or there is this insufficiency of amount of oxygen to his brain, and that causes his muscle to loosen, and now he is on the floor. So, as a primary survey, we should always secure the place in order not to worsen a possible scenario. So we should clear the area. Same as this vase. Ipalayo na to, because it might cause further danger to our patient. So this faint, we can assess that it was caused by too much exhaustion, too much pain from the thing that was blocking to his throat, and also by emotional stress because he is gasping for his life. Now, we will be doing a primary survey. The first one is get away the stuff that could harm danger. The other one is to check the response of the patient. We have a abbreviation to check the response of the patient. That is A, V, P, and U. A for alert, which would assess the immediate response of the patient to stimulus. Sis, okay lang ka, sis? Okay. And also, we would ask him through voice, and as mentioned, he was able to respond to me. Kaya pa ni mo? Okay, okay na ka? So he can speak, and also ask if he, since he can talk, we can ask asa ang sakit siyang part. Asa ang sakit siya mga? Okay, sige, relax lang ha. So, he is, yes, responsive, but anytime, he can be unconscious once again. So let us try to call 911 for immediate response and ask anybody to help. And while waiting for the ambulance and those medic, we can help the patient to secure himself, make him assured, and also get him away from the possibility of shock. So now I will be letting the patient back to his anatomical position. Relax na yung mga kamay ha. Make sure that he is on a very comfortable spot. And also, I will try to elevate his feet using these pillows. Relax naman ha. On this position, we can secure that the patient blood flow will be going to his brain, and so therefore, his homeostasis at this position can still be balanced. And we can refrain from possible shock since the blood pressure and the oxygen supply has been declining. So, on this instance, we will just wait for the 911. We'll just wait for the 911 to come and to administer better help into him. And since he is unconscious, we can just check onto him every now and then if he is he is still conscious. Okay lang ka? Kaya lang? Sige, magpaabot ng lahat. Relax lang. And wait for the paramedics to come. Yes, thank you so much. That would be all.